Amazing. Good afternoon, everyone. Thank you for joining us for today's webinar, Social Connection and Quality of Life, a research project in long-term care homes, co-hosted by Family Councils Ontario and CARP Ottawa. My name is Taeyang Zhang. I am the event and project manager at FCO. And today we have our guest speaker, Jennifer Bethel, who will be presented by Kathy Wright from CARP Ottawa following my introduction. So before we start, I would like to take a moment to recognize the land on which we are gathered today. We are meeting on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We wanted to share a few logistics and housekeeping rules before we turn things over to my co-host, Kathy. First, I will pull up this poll with two simple questions, asking which category among these you belong to, and how you heard about this webinar. I will leave it up while I continue with my introduction so you can answer. Amazing. You'll also notice that all participants are in listen-only mode. We have reserved time today at the end for an interactive question and answer period. At that time, we invite you to use the Q&A box to ask your questions to our guest speaker. You can also use the chat feature to let us know of any technical issues that you are having. And also for your information, today's session will be recorded and will be made available to participants on Family Council's Ontario website and YouTube channel. And now it is my pleasure to turn things over to today's co-host, Kathy Wright from the CARP Ottawa chapter.
Thank you, Taeyang, and thank you to all for joining us today, and particularly to all the staff at Family Councils Ontario for their great collaboration with CARP Ottawa. CARP Ottawa is a local chapter of the Canadian Association for Retired Persons, and our working group on long-term care has been collaborating with like-minded organizations throughout Ontario for many years to champion change from institutions to homes. This means a transformation from the traditional institutional, medical, task-oriented model of care to a person-centered approach in a smaller home-like setting where residents, staff, and families all live within a community receiving the dignity and respect they deserve. Given what we know about the long-term care system in Ontario today, you may think this is impossible to achieve, but it's not, and we have proof. Many other countries have already implemented a transformative change using different approaches and have reported better outcomes. And some of these innovative models have arrived right here in Ontario and in other parts of Canada. And many have reported better outcomes. So we're working hard to increase awareness about the positive opportunities that exist to enhance the quality of life for both those living and working in long-term care homes. If you'd like to have more details about our work, you can visit our website at www.changeltcnow.ca, where you can find the recordings of all our past webinars, as well as details on the various innovative approaches to care. And now I have the pleasure of introducing Jennifer Bethel. Sorry, Jennifer. Jennifer is an epidemiologist and affiliate scientist at the Kite Research Institute, Toronto Rehabilitation Institute, University Health Network, Pew. Her research interests include social connection, older adults, dementia, and long-term care settings. She co-leads the engagement of people with lived experience of dementia program within the Canadian Consortium of Neurodegeneration and Aging and the Social Connection in Long-Term Care Home Residents, the SONNET study, and that is what she will talk to us today. Being actually able to measure the quality of life, or at least in part the quality of life with other measures in long-term care, could be just what is needed for us to convince others to help make the change from institutions to homes. So we're very much looking forward to hearing about your progress, Jennifer. Thank you so much for taking the time to be with us today. The mic is now yours.
Great, thank you so much, and thank you for inviting me today to talk about a topic that I feel quite strongly about, and I'm really excited to talk about. So let me just get to the first slide. It's always this moment. And start from the beginning. So again, my name's Jennifer Bethel. I'm a researcher at the Kite Research Institute, which is at Toronto Rehab. And I have an appointment at the University of Toronto. And I should introduce myself by saying that I've also never lived or worked in a long-term care home myself, except for when I've been welcomed in to work on research projects and also working with an organization called the Ontario Association of Residents' Councils. So I'm really excited to speak to you about this topic of social connection. The learning objectives for the presentation, we always like to put these up in research, is really, by the end of this presentation, the idea is that you'll be able to describe social connection and its important link with health. Think about some potential strategies that might work among residents of long-term care homes in terms of building and maintaining social connection, and then to be able to describe a little bit about a study that we're working on right now, an international study aimed at improving how we measure social connection in long-term care homes. So as a brief outline for the talk, I'm going to talk to you a little bit about what is social connection. You may hear about loneliness and social isolation. I'll put all these pieces together in one conceptual model. I'm going to talk about why social connection is important in long-term care homes. I'm going to talk about some specific considerations for long-term care homes, and in particular, when we're thinking about research and when we're thinking about measuring social connection. Tell you a little bit about what we know on this area, and then tell you about the Sonnet study. So what is social connection? Social connection is really an umbrella term to describe, the ways that we interact or the ways that we connect with other people. And it really goes on this continuum from being observed and experienced. So we can think about our social networks. We can count how many people are in our phones or in our contact lists. We can count how many times we go out with our friends or spend time with other people. But then as we move along, we can think about things like social support. So the assistance we get from other people in terms of advice, in terms of, getting a ride to places, excuse me, you name it. And then as we move all the way to the other end, there's this concept of social connectedness. And this is really about feeling a sense of belonging, a sense of, positive relationships. And we think of it as sort of the inverse of loneliness. So it's really important to point out that, these concepts, although we think of them all together, are really, they're different, but we put them under the umbrella of social connection to acknowledge that they are related to each other. But I think, most people would appreciate that, you can be lonely in a crowded place, and just as you can be perfectly happy, spending time on your own for days on end. So it's really, these concepts are related, but they don't overlap completely. And the other thing to say is really when we think, we often hear the words social isolation or loneliness, but we also have to think of those things in their converse, and thinking about the strengths. So thinking about social networks, social engagement, social support, and connectedness, all of these concepts that are the reverse of sort of these negative ideas of social isolation and loneliness. So why is social connection important in long-term care homes? And the simple answer is because it's important for everyone. It's important for all of us. And there's more and more research coming out that links things like social isolation and things like loneliness to outcomes like heart disease, stroke, dementia, and even death. And it's often quoted that loneliness is the equivalent health risk of smoking 15 cigarettes a day. It's really, there's this accumulating evidence that it's really the way we spend time with other people and how we feel about our relationships is really an important driver of health. But you don't have to take my word for it. These are some recent reports out of Canada, out of the UK, and out of the United States. So you'll see first the US Surgeon General report on loneliness and isolation, which lays out the health risks as well as some policy options. There's a report from the UK that actually has a minister of loneliness dealing with this issue. And you'll see, excuse me, at the bottom, the first ever clinical guidelines published in 2024 that came out of the Canadian Coalition for Seniors Mental Health and the Canadian Association of Geriatric Psychiatry that really tries to lay out, how to manage social isolation and loneliness in older adults. So all this to say, it's really becoming an important health issue worldwide. So why is social connection good for us? Why is it related to health? And so there's a few different sort of mechanisms that can link social connection to health, and we can think about the biology, psychology, and behaviors, but I'm going to use an example closer to home. When I, get together with friends, I might sit on a patio and talk about the things that are stressing me out and feel better after that. So that's good for my health. My husband goes and he plays floor hockey with his friends. So they get their exercise or physical activity out of it. So really, there's lots of reasons why social connection is good for us. And we can think of all the sort of positive impacts it might have on our life. And of course, there are negative impacts, but I'm going to focus on the positives here. So why is social connection important in long-term care homes specifically? Well, it has, as I mentioned, it's a basic human need, but it also has multiple meanings in long-term care homes. It's essential to quality of life. And just as with the general population, it's associated with mental and physical health outcomes for residents. It's also a key aspect of quality of care and person-centered care. So ultimately, it's just essential in long-term care homes. So what are some specific considerations for long-term care homes? And as a researcher, developing a measure of social connection or thinking about doing research in a long-term care home, these are some things we think about in terms of how to do the study or how to measure social connection outcomes. And we can think about the residents. They're mostly older adults and many with sensory cognitive impairment. Excuse me. Many have families that provide ongoing, daily, vital social support, whereas other residents may have no family members involved in their care or their daily life. Staff provide daily care to support the residents, but there's often, staff limitations or high staff turnover. The homes themselves are communal settings. So really, residents eat meals together. They have the opportunity to participate in grouped activities together. It's really one of those settings where you say it's almost that they're never physically alone. And communities often get involved in the life of the home. So really, when we think about research in long-term care homes, we really need to consider all of these things together. And so what do we know about building and maintaining social connection in long-term care homes? Previous research has looked at the effects of individual level interventions. So everything from, gardening groups to reminiscence therapy to different arts-based activities. They've looked at home and community level characteristics. So this would be of interest to the group as they've looked at, the size of the home or the care model or the staffing level and whether this is related to social connection outcomes. And even excuse me, during COVID, we worked on a study that looked at, what strategies might be useful during COVID-19. So although there's this body of research out there, I will say as well, interpreting the research evidence is quite challenging. Some people will say loneliness, other people will say social isolation when they're talking about the same thing. And when they measure these concepts, a measure might be called social engagement, but it's really measuring loneliness and vice versa. So there's really this kind of, mismatch sometimes of, how we label things, how we measure things. And truthfully, many measures are not tested or developed specifically for long-term care homes. So when we talked about those different considerations, you can't really take a measure of loneliness, for example, that was developed in college students and then expect to use it in a long-term care home. So really, there's no consensus or gold standard approach to how we measure social connection in long-term care homes. But I'd like to highlight, and this is some work that we did during COVID-19 with Family Councils Ontario, with Behavioral Supports Ontario, and with the Ontario Association of Residents Councils. And we looked at all the research that had been published before COVID and studies that had some sort of social connection outcome, and tried to figure out, thinking about examples, thinking about what was practical during the pandemic, some strategies that might help build and maintain social connection. This is a beautiful infographic designed by my colleague, Ellen Snowball. And so these are the things that came out of the literature. And some of it's sort of some basic care, good care related strategies like managing pain and addressing vision and hearing loss and managing sleep. But some of them are sort of these adaptable strategies that might work for some people, depending on the person, depending on the home, depending on the context. And I'll go into them just a little bit more in the next slide. So some examples, actually, we worked with Behavioral Supports Ontario, and some examples that came out during COVID of specific strategies or specific ways people have enacted these ideas, or thinking about treating and managing pain, making sure people's glasses are working and their hearing aids are clean and working and switched on, and managing technology as best as possible, thinking about the activities, connecting to religious communities, and even this can be done online or by phone, even if it's not in the home. Letter writing, but also to point out that sometimes even solitary, purposeful activity can leave us feeling sort of engaged and socially connected. But I have a photo down at the bottom, and this might have been my favorite example of all the strategies. This was a home in November 2020 in Northern Ontario, and I guess the residents were missing the chance to go hunting, which was a typical thing that they did in the area. And so staff put on their reindeer headbands, and the residents shot them with Nerf guns. So they just had a really, this is an example probably of a few strategies mixed together. So now I'm going to speak to you about the Sonnet study, which is something I've been working on with colleagues for the past 2.5 years or so. And I'm working with a collaborator in England. So essentially every aspect of the study that we're doing in Canada, we do in the UK as well. And our team of researchers from across the globe, really, from the UK, from the US, Australia, Canada, with staff and trainees and people with lived experience. And this grant itself is funded by the Alzheimer's Association and Brain Canada. And they had a specific funding call for people with interest in measurement. So they essentially said, we have all these issues around research, and one of them is that we don't necessarily measure things very well among people living with dementia or among settings like long-term care homes. So they specifically set aside funding for research in this area. So the Sonnet study itself, ultimately what we're trying to do is improve the health and care of people living in long-term care homes by creating a new measure of social connection. And the project itself had 3 specific aims. Aim 1 was really looking what was already out there. So we didn't want to reinvent the wheel. If there's a great measure, we wanted to know about it. And we certainly wanted to know about the trials and errors of existing measures. And then in Aim 2, we wanted to speak to residents, families, staff, researchers to find out what's important in terms of social connection in long-term care homes, so that if we were going to develop a measure, we made sure we were sort of on target as to what was important. And then finally, we developed and tested a new measure. So I'm going to speak a little bit about each one of these 3 aims. Aim 1 is complete, I can tell you, and about to be published. Aim 2 is submitted for publication, and Aim 3, we're just working through the data analysis now. And I also just want to point out that in the Sonnet study, it was really important to involve people with lived experience. And we did this through program that Kathy mentioned at the beginning of the webinar, the Canadian Consortium on Neurodegeneration and Aging, or the CCNA, Engagement of People with Lived Experience of Dementia Advisory Group. It's a bit of a mouthful, but it's a people with lived experience of dementia. Many have lived experience of long-term care. And they got involved in the project in terms of helping to, set the agenda, identifying it as an important topic. They helped me refine the interview guide in terms of how we asked our questions and helping to interpret the findings. So when we looked at our model of social connection and looked at the different pieces, social support, social engagement, helping us to sort of refine what was the most important to focus on, but also get some input when we drafted our items. So we asked our questions. And I think there's a couple of UpLib members on the call today, which is great to see. So AIM 1, our systematic review, essentially we looked at all published research, or we tried to. We worked with a librarian, we did this systematic search, and ultimately, found 6,000 plus papers, which we distilled down to 62 studies that reported on 38 measures of social connection. And these are measures that were developed and tested specifically in long-term care homes. And we found 13 were developed specifically for people with dementia. 21 measures measured quality of life, well-being, life satisfaction, sort of a broader concept, but had social connection as a subscale or a standalone item. And then 17 measures that specifically targeted social connection. So anyone who works in long-term care homes might be familiar with RAI data. There's something called the Index of Social Engagement. So that would have come up in our study, and it's a specifically targeted measure of social connection. But when we analyzed all these measures, we did this very systematic and rigorous analysis that was led by a research associate, Neha Duan. We found that ultimately none of the existing measures had sufficient evidence to be recommended for use. So although these 38 measures were out there, none were had the psychometric properties that they could be recommended for use. And when we looked at the aspects of social connection covered by the measures, so this was work done by a master's student, Madalena Lugas. She looked at all 38 measures, and then she looked at all the questions that all 38 measures asked about, and she tried to map those questions onto the different aspects of social connection. And she split those out according to whether the measures were dementia specific or not. And as you can see, really, that these measures really covered the gamut of social connection. They tapped into social support, social engagement, loneliness, and social connectedness, and really covered various aspects. And this was a really helpful analysis for us in terms of thinking how to create our own measure. So AIM 2 are qualitative interviews. We interviewed residents, staff, clinicians, caregivers in Canada and the UK, really trying to get at the question of what are the important aspects of social connection in long-term care homes. We use this information to create our measure, but we also have reported on it. Our research associate, Hannah, was working on this project, has prepared a publication, and she did a qualitative analysis looking at, what are some important approaches. So I suspect none of this will be a surprise to many people on the call if you live, work, or visit a long-term care home. But really the importance of being familiar with life in the home to support social connections. So working on ways to make the home feel less institutionalized, helping residents spend time in meaningful ways, and increasing freedom of mobility. And I think this was an issue that came up during COVID, that residents were cohorted and so couldn't see residents or friends on other floors. The second major theme was really the importance of physical and also virtual access beyond the home as strategies to maintain contact. So outings were important to some residents and families, the importance of providing support with technology. So some residents worked with technology really, really well, but needed staff support. And of course, the important role that family and friends have in the life of the home for the individual resident, but even there was examples of quotes that families, took the time to speak to other residents in the same hallway or same section of the home, same neighborhood. The next thing was really the importance of getting to know residents to deepen relationships. So the importance of staff using routine care and interactions as opportunities for social contact, and really how important it was to use family and friend knowledge as a resource when thinking about how to build and maintain social connection with residents. And really how fostering resident relationships has been quite positive. So for some residents, finding new friends in the home. And finally, as the fourth theme, the person-centered approaches to build social connection. So appreciating the reality that in a long-term care home that many people have sensory impairment or cognitive impairment, and managing to facilitate social connection for everyone. Accounting for adjustment and sociability. So really just people enter long-term care homes just as the rest of us enter a room, as some people are very social and want to be, around people all the time, and others aren't, and how important it is to acknowledge and respect and value those different approaches. The importance of using communal space well, and of course, prioritizing psychosocial needs. And I think this is part of sort of a bigger discussion around culture change, where, excuse me, where care is seen as not just physical care, but psychosocial care, and the importance of social connection to health, to well-being, to care, and really quality of life and sense of home. So AIM 3, it's incredible how quickly 2.5 years go, but we've developed and tested our new measure. So we drafted, when we talk about a measure of social connection, it's questions that it has to be relatively practical and easy to implement. And we created a version for residents to self-report, as well as a staff report version. And we based this measure on what we found in AIM 1, so that's systematic review, looking for all the existing measures, as well as the interviews that we did in AIM 2. So we started with a list of 58 items, 58 questions, which we got down to 30 with feedback from the study team. And then we got that down to 20 based on feedback from our lived experience panel. And then we did what was called cognitive interviews with residents and staff. So essentially going through the questions, asking people to answer them. And if they hesitated, we'd say, why did you hesitate? If they were unclear, we'd ask them why they were unclear, just to make sure each question worked well. And then we did field testing with residents and staff in Canada and the UK. So essentially we went out to homes and tried to ask those 20 questions to residents and to staff. And I can tell you from the experience that actually this was done not during COVID, but in a phase where we were still masking. And one of the questions was about being on friendly terms. And so with a mask on friendly sounded like unfriendly. So we actually had to sort of revisit some of the wording just to make sure that everything not only made sense to residents, but was practical and with a mask or without. And then we got to the stage of psychometric testing with residents in Canada and the UK. So essentially down to those 12 questions. And we wanted to know, if I asked the question or my colleague asked the question, do we get the same answer? If we come back 2 weeks later, do we get the same answer? Does the measure of social connection correlate with things that it should, like, trying to think of an example, ADLs or activities of daily living, for example. So we would measure other things and just to see if the two correlate. And the analysis for this part of the study is now underway. So in terms of next steps, we will be reporting our results in an academic paper, but we also have a website, and we want to make sure that we report back to those people who participated in the study. So we'll be creating, an infographic and a video. And ultimately, the measure will be freely available to long-term care homes in Canada, in the UK, or really anyone who wants them. And the idea is that it'll be suitable for observational and intervention research, and it'll be practical for real world settings. And what I'd like to do next is, to make sure that this measure is accessible and useful and practical across Canada, and that we can make comparisons and look for health equity issues, is to create a French-Canadian version. So, summing up, if you didn't pay attention to the previous 25 or 30 minutes, I'm going to give it to you all in one slide. What do we already know? We know social connection is essential in long-term care homes. We know it's associated with better mental and physical health and cognition. This is true in residents, just as it's true in all of us. It's a key component of good quality care in long-term care homes. There's strategies or interventions out there that might improve social connection in long-term care homes, but the evidence is pretty limited in terms of the number of studies, in terms of how comparable they are. And there's no consensus or gold standard approach to measuring social connection in long-term care homes. People have used many, many, many different measures, and sometimes just made up their own for specific studies. So what has the SONNET study produced? A conceptual model of social connection for care homes. So putting those pieces of social support, social engagement, loneliness all together in one model. It's created a detailed inventory of the measures that already exist, that already have been tested in care homes. It's given us an understanding of the barriers and facilitators of good social connection through those qualitative interviews. And very soon it will produce a new, acceptable, valid, and reliable person-centered measure of social connection for use in long-term care homes. And before I finish up, I'd like to acknowledge the many, many people and organizations that helped in various ways in the study. So I'm particularly grateful to the people who participated in the studies, the residents, the families, and the staff. It really was a privilege to interact with you and come to your homes. And in Canada, I'd like to give special thanks to the people and organizations that helped with recruitment, which included Family Councils Ontario, Ontario Association of Residents Councils, the Alzheimer's Society, Behavioral Supports Ontario, Jarlath Health Services, and other homes across the province. So thank you all. And here is my information. Our website, the first has some resources about social connection and some current research and some articles that are freely available. The second is the SONNET study website. So that's speaking specifically about the website, or sorry, the SONNET study. And finally, my email address, please reach out to me anytime. I'm very happy to talk about the study, the results, and the next steps. So I'm going to stop there and see if anyone has any questions.
There's a few questions in the Q&A box, Margaret.
Yes, I'm unable to see the screen here, and I'm just trying to figure that out, Taeyang.
I see one. Are you able to share any of the research articles?
Right.
And I'm happy I can answer that.
Go ahead. Go ahead.
Yeah, and they're on the website, and so there's a couple articles that have been published, and we make sure that we publish open access, which essentially means, researchers can pay a little bit extra to ensure that there's no paywall. So if you click on the link, it opens. You don't need to have a subscription to the journal or anything like that. So if you go to either of these websites, you'll find a bunch of papers linked there, but there's actually two papers that should be coming out really any day now. And so hopefully we'll have those up there as well very soon. So yeah, the articles, if you go back to the website, either website, hopefully you'll find them there, but stay in touch because there's some coming out very, very soon.
So there's a couple more questions there that you can see. When do you expect the results to be ready, Jennifer?
Yeah, so for the final study for the measure and for it to be freely available, I think that should be coming in the next couple of months. And so we've just I've been working with my incredible collaborator in the UK, Andrew Summerlad, and we're writing up the article now. We've been working with the biostatisticians, so that will be within the next couple of months.
Okay, and then there's a couple here about how would the tool be used and will it influence education, do you think, for staff? And where do you see this going?
Sorry, I mean, it'll be freely available for researchers, so they can use it for studies. I mentioned there's research that looks at, the size of the home, the care model, different programs, and so they can use it in that scenario. I mean, my my ambition, my aspiration that it would be used in sort of a regular data collection, quality improvement type context, that people could collect ongoing and homes could collect ongoing. But again, people can use it in the ways that work for them. So I think that would be the ambition.
It's interesting, and we're delighted that you were able to speak about this today for us, Jennifer, because, we do a lot of work at CARP with changing institutions into homes. And you've mentioned so many things that kind of point to the work that we're trying to advocate for. And when you started talking, you talked about the importance of social connectedness. And I think one word came up to me, and that was engagement, because people can still feel lonely, but if they're not engaged, right?
Mm-hmm.
So the issue is people don't like to go into long-term care because they feel like they're alone, right? And that's one of the things they look at, is whether they would be happy living in a place such as that. So it's important, really, what you're doing, because their family now becomes the staff and others that are visiting and so on. So it's so very important. And the work that we're trying to do, it's been very hard to kind of find a parameter to point to it. There's qualitative measures, not quantitative, which makes it difficult for us to say, let's have some engagement and activities and home-like settings and get together and so on, and that will improve quality of life. Well, we know it's probably true, but what the work you're doing is probably going to put a number, I guess, on this. Is this how we would view it?
Mm-hmm. That's exactly right. I am a quantitative researcher, and I appreciate, I mean, on some level, we know what basic human needs are, right? We know that we need food and water and clothing and shelter, and we know we need each other. It's a basic human need. And so on some level, people wonder, well, why is this research even necessary? We know this, we know social connection is important, but ultimately, I think when we measure things, when we have evidence that we can put alongside those qualitative arguments and those things that we know in our gut, and we can display it with evidence, that's when it's most effective. We get the most traction, right? So
Right.
That's the idea, yeah.
How many long-term care homes in Canada were involved in the SONNET study? Do you have a sense of that? Or
Yeah, I can tell you for AIM-3, I mean, AIM-2, when we did the interviews, we sort of went broad. And so it was homes, it could be across Canada, because we sort of opened it up to anyone with experience living and working in a long-term care home. But then for AIM-3, for that testing, because we had to travel to the home, we did data collection in person. Those were all in Ontario. And so that was in, I think, 5 different homes in Ontario.
right, and I noticed that Jarlath Mary Connell was one of your contacts there, which is wonderful. She's certainly a voice there for us. There's a couple of other questions. One is, do you have challenges explaining the need for research? Like when you went to these homes and tried to get homes to do the study, was there any pushback on that?
I think I think people are generally interested in this topic. I mean, I think because of COVID-19, I think people think more about social connection and why it's important to our health. So I think it had it on people's minds. And then certainly within homes, like I have to say, one of the sort of great experiences for me was going into homes and meeting with staff who bring so much enthusiasm and creativity to their work every single day. And so it depends, you know, certain staff that I met were just so engaged with the study because in their role, they think this is, you know, this is important and this is an important topic. And so hearing about research in the area was, you know, invigorating for them. So it was really great. I had great experiences in the homes. It was really wonderful.
Well, that's great. Now, we're always going to hear, and we have heard in the chat box from someone who's indicating that how do I get my daughter, who's very reluctant to engage in social contacts? I mean, we're going to hear these stories. It's quite common. I think there's a number of factors that are related to that, but what would you say to this person?
Yeah, I mean, that's a great question because it's true that we have to realize, you know, some people, you know, they're perfectly happy. And I've spoke to residents who said, you know, I'm perfectly happy in my room, listening to my books on tape, and meeting with my family once a week. Like, so solitary activity that's purposeful or meaningful to a person can leave them feeling socially connected still, not lonely. But there's other times when, you know, if it is an issue, and actually I'd switch back in my slides, but I think it would take a while. But there's these new guidelines from that have just come out in Canada, 2024, about managing clinical guidelines for managing social isolation and loneliness. And they give some strategies or some clues in terms of how to deal with this in a healthcare setting. So
But that's in your slides, so we'll be able to see
Yeah.
that when we post the video. So that would be good. Yes.
Yeah.
Good. So do you see any offshoots from all of this? The research tends to promote further research. What are you seeing down the road once you publish your findings on this and so on? What do you think will happen?
Yeah, that's a great point. I have to say, working with people with lived experience, it makes you realize how researchers often our conclusion is we need more research, and that's not quite going to cut it in this situation. So, I mean, I would like to use, my interest is really thinking less about, and I work with colleagues who, you know, create these amazing interventions to think about how we can work with residents one-on-one in terms of social connection. But my interest, I would be really interested in using this measure to evaluate the homes instead. So thinking about home level factors, the size of the home, the care model, et cetera, and thinking about whether that can influence social connection. So to me, that would be a really interesting area of research. But as I said, I would also like to translate it into French. I grew up in Ottawa, bilingual city. And so I think it's really important in Canada to have this measure available in both languages. So that's hopefully a next step coming soon.
Oh, well, that's exciting, especially if you start looking at other parameters like home size and things like that, for sure.
Yeah.
One person is actually asking if you could give us a sneak preview of the kind of findings you have made, just generally, maybe.
Yeah, for sure. It's funny, I was just looking at those slides. And so we looked at, you know, the resident reported measure and the staff reported measure, and, you know, how well each performed. And the resident reported measure worked a little bit better in terms of retest reliability. If I ask the question, someone else asks the question, they're more likely to get the same answer. So anyway, I'm giving you some convoluted response, but actually go to the website, I guess, would be my short answer. And there's going to be a poster up there that we presented at the Alzheimer's Association International Conference that gives just a little bit of a preview of the findings.
Okay, that sounds great. So one of the issues then that we know can be that behaviors can occur, challenging behaviors can occur in long-term care for various reasons. And we think, and when I say we, I say CARP, Ottawa often thinks these are mitigated in terms of how the long-term care home provides the care and the home-likeness of it and the engagement with staff and how they feel one to another and like a family and so on. And that, we believe, reduces behaviors. And I think some research has suggested that is so. Do you see that this is happening? Do you see a need because of social connectedness and how it could be so positive if we could just promote more of this? Do you see a reduction perhaps in the need for behavioral supports?
Yeah, I mean, I think that's an area for future research. I know that people have tried to address that question in terms of, is it an unmet need for social connection that creates different situations? So that's certainly, there's some research on that topic, and I wish I could quote it off the top of my head, but certainly an area for future research.
Right, because we can go down some rabbit holes with behavior support in terms of the solutions that are offered, and if it can just be done in an easier fashion and more easier way, and with engagement and so on, would be certainly better quality of life if we had those approaches in place. So I guess my other question, I'm waiting for more. Oh, we got some other question here. Let me see here. Yeah. Do you think your study may influence the physical structure? Well, here we go, of long-term care homes to make more folks less reluctant to enter a facility to receive support. So in other words, with the physical structure, I think you started to answer that before, to make folks less reluctant to go to long-term care.
Yeah, I mean, I think to me that would be a really interesting study, is thinking about how we build the study, or sorry, how we build the home in terms of the physical environment and in terms of the building itself, where it gets built. I think all of those things, there's qualitative research that says, the location of the home is really important. If it's on the public transit, if it's near shops, if it's near coffee shops, that it's more likely to enable social connection because families are able to visit, families are able to go out, residents are able to go out. So it is really important. So I think that would be a really important or interesting research study to do. But people have, and I wish I could quote all of the evidence off the top of my head. But again, we did a review. So when we looked at the existing evidence and said, what is it about the home? What is it about the home that we know is related to social connection? And people have tested, and there was no sort of clear signal in terms of how big or small the home was or how the care model was designed, but there is a body of research in that area that people are trying to figure out, okay, how do we build a better home and link that to social connection in the residents. So people are using that as an outcome, as a study outcome, as a measure of, success, I guess, essentially.
Oh, that's good. And I guess you mentioned 5 homes in Canada, so it's hard to know, but in your study, but did the size of the home, was that in your study then, was it easier for social engagement in a smaller area, or did it matter? I mean, you mentioned in your big slide, I remember the pictures where you talked about different ways of engaging and groups and gardening and all the rest of it. Did it matter, the size, did you think?
Yeah, we didn't actually look at that. So it was interesting because our study, it was interesting trying to explain the study to say, ultimately we're trying to figure out if we can even ask the questions. And so it wasn't to figure out, how should we build our homes bigger or smaller?
Yeah.
Should we have more staff or less staff? It really was so focused on this idea of measurement, and can we measure it? Can we ask these questions? Can we get good responses? And looking at the psychometric properties. So convince researchers that when we do use these measures, they're valid, they're reliable, and they're useful to study. So yeah, I mean, social connection ultimately is hard to measure. I think if all of us sort of picture our social lives and how we would answer various questions about the number of contacts and the number of times we go out and how we feel about our relationships, it's not easy. And people have boiled it down to something so simple as, are you married or not married? And then people get very complicated and have, looked at different ways of collecting data using location information. So, do you spend time with other people? Do you spend time in common areas? And then people get observed for hours at a time. So it's really, sort of a range of approaches to measuring social connection. But what we've tried to do is create something that's pretty straightforward. It works in England and Canada. And so now we just have to broaden that up a little bit too.
Right. Yeah, I mean, you said it in your presentation. I mean, you can be feeling socially connected and doing things by yourself. You can be lonely in a marriage, for example, right?
Yeah.
So it's hard to pick the parameter of how to test. So yes, it would be a very hard study to do. We're involved in the Change Long-Term Care now, looking at innovative models, and you did Jarlett, so there a lot of those are butterfly. There's also other models. I wondered if you down the road might go into some of those other ones to see if this was a factor, like the Eden alternative or the greenhouse or whatever.
Yeah, that's a great suggestion. So I think, when we think about these different models is sometimes, again, as a researcher, we're sometimes obsessed with this idea of evidence and confidence intervals and data, and can we show this has the effect that we want it to? And so I think it would be a really nice piece of an evaluation when we think about these different models. Does this model change resident social connection? And that would be, of course, a piece of it. We have to think about staff experiences and all sorts of different outcomes. But as a measure of quality of life, social connection really, it's important, and it's, I'm trying to think of the right word, but, actionable potentially. So.
Good. There is one here from Monique who has put it on our chat line with a resource. Monique works for CCSMH, and those new clinical guidelines, she put the website there, the link.
Oh, excellent.
So it's on the chat line. I'm not sure how we're going to share that when the recording gets out, which is what she suggested, but is it in your presentation? I can't remember.
It is, but it's
Okay.
only an image and not the website, but I'm going to go back there just.
Yeah.
There it is. So it's the purple.
Okay. But if someone Googled that, they'd get it for sure.
Yeah, absolutely.
Yeah. Okay, that'll be fine.
Mm-hmm.
Okay. Just kind of thinking too about quality of life. Are you familiar with the RIE tool? The measurement tool in long-term care?
Yeah, I mean, do you mean, so part of actually what inspired this study is that I used to work, I work with health administrative data to do research. And so RIE is one of those data sets, and make sure I'm talking about the same thing, but there's annual assessments and quarterly assessments, and it's got about 300 different variables in it. Yeah.
And isn't there a section there that tries to deal with quality of life? Am I correct on that?
Yeah, you're actually correct that there's a measure of social connections. So there's something called the Index of Social Engagement. It's got 6 questions, and I used to be able to recite them, but it's, does the resident get involved in the life of the home? Does the resident, oh, it's escaping me now. But so, I mean, ideally, the best case scenario would be a measure like this gets sort of subsumed or integrated into a data collection mechanism like the RIE, so that we can use it for research, so that we can use it for quality improvement. That would be great. Yeah.
My understanding with that social, that part of it, quality of life, I'm not sure it's fully being utilized in long-term care. So that's the issue with it. And if they just filled it in, that might help with the data for sure. Yeah, it's been
but it's a lot of data to collect. So at some point is it's not an easy task. Yeah, exactly.
Okay, well, this is I'm just waiting to see if there's more chat here. Not coming here. Okay. Is there anything you'd like to add, Jennifer?
No, I just would like to say thank you very much for having me at the webinar. It's great to chat, and I would hope that people would reach out if they have questions, if they want those articles or reports. Please reach out to me. I'm happy to discuss, and I look forward to sharing. We're so close. Look forward to sharing the final results of AIM-3. And again, I really want to thank the homes, the residents, the families, the staff that took the time to speak to me during the course of the study. It really was quite inspiring in terms of, the topic and the study. So again, thank you for that.
Well, thank you for sharing your knowledge of this, and we look forward to reading the report, Jennifer, and look forward to seeing what further research comes out of
Mhm.
what you've been studying, because I think there's lots of avenues out there that can go from this study. So again, very much thank you for taking the time to share your information with us. So thank you, Jennifer. And I'm now going to turn it over to Tayung.
Great. Thank you both so much. Another thank you, yeah, to Carp and Jennifer for this wonderful webinar today. And thank you everyone for being present and interactive. I also want to share with you that FCO and Carp Ottawa is co-hosting another event in a month. The webinar titled, If It Doesn't Challenge You, It Doesn't Change You, is presented by Lori Norris Dudley, President and CEO of Osgood Care Center, and Lindsay Pasfield-Liu, Associate Administrator and Director of Quality and Resident Engagement at Osgood Care Center. It will take place on Zoom on Wednesday, October 23rd from 12 to 1 p.m. So exactly at the same time as this one and same day of the week. I will share the registration link in the chat right now. But it will also be available on FCO's website and also in our weekly e-bulletin. And as a reminder, this webinar has been recorded and the link to the recording will be sent to you next week. We thank you for your continuous interest in our programming and we look forward to seeing you at our next event. Thank you, everybody. Take care and have a great day.